All right. Hello, everyone. Welcome to the final Public Health Modernization Chat of 2024. I don't fancy myself a person who likes to talk about time and how quickly it passes, but I'm finding myself compelled to notice how quickly this year has gone. Thank you all for coming. Thank you for indulging in the song for folks that are not familiar with that particular band. They are called Pentatonics, and that was their a cappella cover of White Winter Hymnal by the Fleet Foxes. And I can put that information in the chat if folks would like to listen to it again or other versions. Um, and yeah, I'm going to pause my talking and I will pass it over to Dolly so that she can introduce herself once again to the group.
Hi, and good morning, everyone. Ellie England, Sheer Queen. I'm the Community Engagement Strategies Manager. Thanks to Sarah for being our IT queen with the mostest, who we do have captions available. You can click the closed captioning button at the bottom, and or you can access Spanish captions in the chat. Uh, This is our year end. Do we have a warm-up question? Do you need me to share a warm-up question? You have one?
Yes, I had one.
Okay,
And
excellent.
also, thank you all for your patience with me. I am at the last day of a cold that I caught last week. So you're going to see me using a lollipop version of a cough drop. Thanks for your understanding. So yes, warm-up question. I am hoping that y'all can share with us in the chat, or you can share verbally. Um, as we are transitioning into winter, we are a couple weeks away from our shortest day of the year, and the winter equinox. What ways are you attuning to the season by resting and staying cozy and really taking what nature is trying to tell us, which is that this is a season for recuperation? Um, yeah, I'm just curious what folks are doing to stay in the vibes of the season. Um, I will say for me, has been a little bit easier to rest over the last week because I've had a cold. And so whether or not I wanted to, my body was like, here's the plan, do a good job. Um, but yeah, where are folks at? Or what is the way that you would like to rest and you would like to be cozy and you would like to recuperate um, as the season is nudging us towards those practices? And anyone is welcome to share in any way that feels helpful to them. Oh, okay, now they're coming in quick. Game nights at friends' houses. I love this. Reading some good fiction, doing some activities like paint by numbers, taking advantage of the sun in the morning, taking long walks with my dog, and doubling up on my Celexa so I can rest in a way that feels less sad. Yes, at home under a blanket with coffee. I'm seeing some pets, warm drinks, fires, taking it one day at a time for my first autumn and winter in Oregon. Yes,
Now, I wonder,
great
this is
strategy.
Dolly, how many people did some retail therapy recently? Now, I try not to be a super capitalist, but man, I love a deal. So everybody in my house is getting socks because I hit up Fred Meyer. It feels like the smartest gift that one can get is a solid pair of socks.
This is Sarah with the OHA team. I use she and her pronouns. Thanks for sharing that, Dolly. You know what I bought a lot of this year? I I go for a lot of walks in my neighborhood in the evenings, and I've noticed that people are doing a lot of lights. So I got super inspired in like October, and I bought a bunch of lights. And I put up one string and I broke the string, and then I decided I'm not doing any more. Like I've completely lost any will already to do it. But if anyone really likes hanging lights, let me know.
You just described the garland situation.
Exactly.
I got one of the like three things of garland put up, and then I was like, this is a dumb project.
What kind of garland was it? Sorry, then we can get.
Real garland.
Oh,
Yeah, it was
fancy.
a waste of my money and time. I should try less hard next time.
Yeah.
Well, I'm glad we have similar situations. Oh, look at that, Karima. I love it. Thank you. Okay, so let us get back to the topic. We're reflecting, right? We're going to reflect on 2024. It's been a year, y'all. We made it. Woo, woo. Let's pat ourselves on the back.
Yes, we did. Um, Also, I really like, Dolly, that your answer tied in the cozy aspect of the question because a really good pair of socks, those are the vibes. Those are the vibes. Um, oh, I love a pun. If you haven't been to the chat in the last 2 seconds, Michael's come in with a really good pun, and I super appreciate it. Michael says, I watch The Wizard of Oz every holiday season. Does putting up a Judy Garland count? And I just want to pause and hold space for that brilliance. Thank you, Michael. Also, if you could like describe what that looks like, because I have many ideas in my head, um, feel free to continue. There's a thread happening in the chat. Feel free to let us know. All right. So, quick emoji check. How many folks here remember the last 11 topics of presenters from 2024? There's no grades, just asking. See a couple people shaking their heads like, why would you do this to us? Okay, so I am going to share them with you. Yeah, okay, a couple thumbs down, right? Right, because that's not an expectation. We don't expect that everybody remembers everything about everything all the time. That's not how being a human works. But luckily for you, I have been keeping track of all of the things that we have talked about in 2024, and I'm going to share them with you as a little reminder. So, for January, oh, thank you, Jody. Yes, my cough drop lollipop. I would also highly suggest these. It's way more fun to do a lollipop medicine than it is any other type of medicine, in my opinion. So, thank you, Jody, for the shout out. I'm going to take a little screen grab of my list very quickly, and I will put it in the chat so we can all remember what we talked about in 2024. Give me one moment. Oh, that's funny. It won't let me send it. It says I don't have the administrative authority to send a picture in the chat. So we're going to improvise. So in January, we had Sharina Walker, which is our policy and partnerships or our policy lead. And she came to share with us about our legislative session overview, just a general description of like what to expect, how does it work, the timelines. And it gave some resources for folks about how to be engaged in that process. How do you contact your legislators? What does it look like to give public comment? And how you also can share that information with the folks you work with in your communities who might also want to participate in that process. And then in February, we paused for a second and we talked about the history of this space and how it was created in 2020 as a space for folks responding to the public health crisis, the COVID-19 pandemic, and how its purpose has and what the goal of this space may have shifted over time, but that we can't forget the value of creating space with community, that we are coming all together to learn, to share, to grow, and how we can best engage in public health in our communities. In March, we had round one of the 1115 Medicaid waiver benefits, and we talked about climate. And that's where we had Amelia Reynolds come, and she shared about how the different benefits that folks can access through Medicaid around getting some examples. We're getting air conditioners in their home to help with the heat or the heat domes, and also to potentially have access to ways to safely store certain medications that require a specific temperature. Those are just two of the examples that Amelia shared, and how that climate benefit was rolling out this year in 2024. In April, we had, oh my gosh, I'm forgetting her name. Anne came to talk about viral hepatitis and all the work that the viral hepatitis team was doing, the successes they have, the strategies that they are using to address that health issue in Oregon. In May, we had the Oregon Department of Transportation come to talk about their innovative mobility program. And they also talked about a funding and grant opportunity. So that was a very exciting one. In June, we had the Department of Early Learning and Care Baby Promise program come and present and share about the work that they are doing. In July, we did not have a meeting because it fell on a federal holiday. So we skipped July. In August, we had the Public Health Advisory Board Workforce on Community Engagement come and present what their strategy had been, what the work they've done around community engagement. They also used that as an opportunity to gather some feedback and input from you all. There were breakout rooms. It was facilitated by New Hayes, who has been a facilitator for many different spaces within OHA for a while. In September, we had the Medicaid waiver team come back and talk about an HRSN benefit around housing. And I remember that y'all said you wanted them to come back to talk about the other two benefits that will be going live in 2025. So I have that set in my brain. In October, we had Jill and Emily come from the reproductive health team, and they shared a lot of information about how to access reproductive health in the state of Oregon, specifically focusing on a really timely and a very important conversation around access to abortion in Oregon. And so that was a really great conversation. And I feel like folks had a lot of their really important questions were answered through that presentation. And then last month we were here and we had Dr. Dean Seidlinger and Jamila Norton come to share about the progress that they are making on the state health assessment. And that was also a presentation where folks said they would like them to come back and let them know what the end results of the state health assessment are, and how that is also going to be influencing what the state health improvement plan priorities will be moving forward. That was a lot of information. I apologize I couldn't give it to you in a picture, but I just wanted to refresh people's memories and ask, I will continue to see if I can write all that down in the chat. What felt like a significant learning opportunity for you? Was there one of these presentations that felt like it really impacted you, or that it was something that you felt you could start applying to the work that you're doing in your communities right away? And if there's a different way to ask that question, please, Dolly, pop in and add some context, but that's the prompt I want to start us with while I get back in the chat here.
Hi, I'm actually going to do something completely different, Heather, and I'm sorry. I'm gonna derail us a little bit. I need to check in with partners. I'm just getting some information in. It seems that there is a tsunami warning currently in Oregon. I want to flag this for any of our coastal partners that might be in this call right now. I'm dropping a link. It looks like it's earthquake south of Florence, south of Eureka that just happened. So I'm gonna just say this out loud because I love my people on here. And so I need to just check in with any partners that might be located on the coast right now. Dropping the article from KGW. Take care of yourself, okay? Josephine County, y'all cool down there? Okay. I'm just saying this out loud because we felt it here and evacuated. Okay, Janet, you don't have to be on the call still, girl. I love you and your commitment to public health. I need people to take care of themselves. So I'm just going to say that out loud. Take care of yourself, take care of your community. We're going to keep an eye on this. Breaking news. Okay, I'm sorry, Heather. What were you saying? The
Um,
world.
um, please don't apologize, Dolly. I did not get that notification anywhere because I have all my screens up to facilitate this meeting. So I appreciate that um, people had access to that information in a timely manner and they chose to share it. So thank you, Dolly. I'm going to echo what you said. Please, folks, take care of yourselves. Um, I know that this might seem silly to say out loud, but if you are in a place where you need to prioritize your safety, you do not have to stay on this call. Uh, you don't need our permission, but we will give you permission. And please, if there's ways that we can help support you, I know that there are many folks here in community with you, as well as lots of OHA staff who would be ready to uh, figure out how to do that for what you need and to the best of our ability.
Oh,
So,
Janet, I'm glad you got left back in.
okay.
That's really good news. So here, Heather, can I propose something to you? So kind
Yeah.
of just like going from what you said, as a collective, let's just think about 2024. A lot happened. Things maybe we didn't expect to happen, things we were expecting and we were ready for, things that made us happy, things that made us sad. I'm curious to know from your perspective, all of you partners, what's something that you're really proud of that your community took part in making happen? What are you proud of this year? What are you proud of? Feel free to put it in the chat. If you want to unmute and tell everybody about it, feel free to raise your hand. But I know that we're doing really hard work every day. And I just think we should give each other some praise. So if you did something that you're proud of, what is it?
Okay, I'll go because I always go. No, I'm really proud of the fact that I'm still here, to be honest with you. We went through a cycle, which had a lot to do with the whole HRSN thing, but that's another subject where you just felt anyway, but financially, I had some I have, bottom line bookkeeper saying, "Oh my gosh, Betty, this is awful. This is awful. You got to close down. You got to close down." And what I was hearing did not compute with what I was seeing in the bank account. I was being told, we have no money. You got to close down. I'm like, but I see money here, but we have no money. And so it was one of those things where you felt like you know what? Sooner or later, you got to stand up and just dig your heels in and keep going, period, no matter what's said, And I feel like what this space does and Fiscal Friday does is that it gives you backup when you feel like you don't have any. And so we've come through that time. I was right. We did have money. Nobody has apologized for trying, but and so I do. I think what's important about this space is confidence. It helps to build your confidence. You hear stories that are a lot worse than you. So you're like, what am I worried about? I'm going to keep going. And that's what I'm proud of. I'm proud that I didn't walk away when everybody was saying the sky is falling, you better get out quick. And and it just was that, I could go on and on. It was just very interesting how people I just think people are interesting. They really believe that you're going to walk away from feeding 84,000 people last year. I wanted to say, do you know if I walk away, what that means to so many families? It ain't going to happen. And so that's what I'm happy about. I'm happy that we're on the other side of that. I'm happy that I didn't give up. I'm happy that when I was crying on Fiscal Friday, people said, you better quit that crying and get going. I'm happy about all of that. I'm happy. Yeah. And I'm happy, proud. I'm proud. Okay, one other thing. So I'm in California because my father wants me to take him to his doctor's appointment. So I'm telling my dad all about this whole thing, and he's just sitting there. He's 84. He's just nodding like I kept thinking he's thinking, you better get up. You were taught to get up, girl. You better. He didn't say anything, but he says, it's good to hear that all that happened, Betty. But anyway, so that's all. I'm happy for the connection. I'm happy. I mean, I think all the topics are amazing, especially HRSN and syphilis. I really like those two. But I think the most thing is that we're building. We're building. That's what I think. I think we're building and we're building strongly, and we can't take that for granted. And that's what I'm happy about. Okay, that's all.
Betty, I love that you ended it with that's all. And one of the comments in the chat from Misha says, Betty, you have so much to be proud of. So you got some kudos waiting for you in there.
The chat is popping off.
Yeah. I was gonna say,
Um,
Dolly, should we?
okay, let's see here. Proud of resilience team members. Josephine County started a CBO funding program in 2023. I think you mean 2024, but I know exactly what you're talking about, Michael. Lincoln County Climate and Health Group, our Lincoln County Climate Team. Woo woo, wonderful people to work with. Um, I didn't have a hand in it, but I'm very proud of the environmental resiliency staff for conducting an environmental scan. Lots of cool work happening. Yeah. Everyone's proud of Betty. Uh, let's see. My team's resiliency in the face of systemic barriers and cultural norms that exist institutionally and socially. My team has been so incredibly welcoming, warm, and adaptive to the constant of change and always puts what's best for the community and each other first. It's amazing to witness and be part of. All the programs with emergency preparedness have been able to pilot and create with being a new nonprofit. Hey, being part of a community that collectively cares and supports each other with care and love. I'm on my union's bargaining team at PSU. Hey, things are tough, and I feel really proud of us doing the best we can with what we have at the bargaining table. Um, I'm very proud of so many things. The one I want to recognize is our food pantry and the partnerships we have with farmers and the fresh, wonderful produce that we provide. Great partnerships with grocery stores as well. Love the community involvement. Um, Lots of love for Betty, 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 Betty. I am proud that we all still are here and talking and learning from each other. Yes. I am proud that this space is allowing us to meet new organizations and plot partnerships. Plot partnerships for the future to make us all stronger. I love that. Would anyone else like to unmute and share?
This is Sarah. I think one thing that was uh, uh, really quite stunning to hear all of that. You know, when I think about what brought this group together 4 years ago, because we've been meeting here monthly for 4 years at this point, you know, it's under the umbrella that we talk about for public health modernization, which is really how we're building the public health system in Oregon that we think people in Oregon deserve to have. And just listening to all of those comments about partnership and about community, and then, you know, about climate, environmental health, emergency preparedness. I'm pretty sure Betty even mentioned syphilis in what she shared. It's just like you all are talking about how it's actually happening, how we're actually doing it and creating that system for people in Oregon. So thank you to everyone that shared.
Can I ask a follow-up question? I'm really curious to know about did any did you meet anyone new from the LPHA? Or did you LPHAs meet any new folks from the CBOs? What about that relationship? Have you made connections? Are you meeting people? Have you plotted?
Well, I just want to say that I'm not directly involved in this, but Felicia, who works with me, has been working pretty well with Multnomah County, the staff over there. So it's better, much better than it's been in the better in the sense that we know who we're kind of working together. So that's been new this year.
Patty, I see your hand.
Yes, we actually did start working with the LPHA in Klamath Falls County. They reached out to us and say, "Hey, we have a person who left, and we have a little money on the side. Would you guys like us to help with the CHW you have here?" And we said, "No, we don't want it." Kidding. But when we started talking about holding wheelchair maintenance workshops in Klamath Falls, they said, "You can use our space." And we were going to do it just the day when the big snowstorm came in. So that did not happen. But yeah, they said you can come and use our space anytime you want. So yay for LPHAs.
We've also got some folks sharing what their plots are. And I asked the prompt in the chat, Dolly, have you plotted? And if so, how? And people are very excited to share. So I want to just highlight a couple of those as well. We've got deepening relationships with our local housing authority. Also, it's a shout out to OHA. So I'll shout out to OHA for helping us with a 21 unit affordable housing complex for those with severe and persistent mental illness. We've been plotting with our CBOs for decades, exclamation point. We have made some out of county allies through this process that we are grateful for. Yes, expanding our plots, plotting, connecting, love it. I just want to say a little special thing. Jamie says, "This is my first meeting, but I'm excited to meet folks today and plot in 2025. Welcome, welcome, Jamie. Folks have plotted with the Oregon Chinese Coalition, the African refugee immigrant organizations, and more. Someone is going to join starting tomorrow an inaugural Benton County Health Communications Work Group. Love that. We made connections with Yamhill County LPHA. It sounds like they have a lot of Ukrainian and Russian speaking families. Forming stronger connections with our ministerial partners, community partners, and outlying cities in our frontier community. Yes. Our LPHA was recognized, our CCHWs, I'm unfamiliar with that acronym, but I'm sure someone will know what it is in this group, as leaders in the community and pulled them into their cohort of trainer support groups, even when waiting for training approval. Yes, so plotting can happen even before all the puzzle pieces are in place. We can prepare our plots to be ready to go when the stars align. Shout out for plotting in general in the chat. That's exciting. Someone says, thanks to these chats, connecting to Lincoln County Spanish serving CBOs with, oh, it's been, I haven't been,
Crisis de Bienestar.
thank you.
It only
Thank
took me
you.
3 years, 4 years.
Love. I haven't conversated in Spanish since college, and so I started to say it, and then I was like, you know what? Someone might be a better person for that than me. Thank you, Dolly. And then we're working on disaster resilience and have uncovered many gaps in the support and planning between our local emergency responders, our healthcare facilities, and our county. Getting everyone together in a room to learn these things takes time. Now we can start to make community level preparedness plans that support the needs of the responders and the community. I just want to pause there and highlight, I see Dolly's nonverbal communication, to highlight the part of that phrase that says, getting everyone together in a room to learn these things takes time. And the value of getting everybody together in a room. Hello, you are currently doing it. You are here right now. I don't know if the person who shared that wants to provide any more context. You are not forced to, but I will mute myself in case you would like.
I can. So I was hired in this position like a couple months ago. So August is when I started, and we were, I think, trying to fulfill a plan for our goal is to have a CERT team, which is redundant actually, community emergency response team. And I thought it was really hard because I'm like, well, this isn't really our role to like house this. It makes way more sense to do with emergency responders. Where are they lacking? What do they need? So getting all of the like city emergency folks in a room to tell us like, hey, do you feel like you have gaps? And getting them to actually admit it also takes time. I guess I should say we're Oak Ridge, rural community outside Eugene in Lane County. But getting that conversation going and then including the county who does want to be more responsive. We received funding to have a resiliency hub that is really just starting to happen. The contracts haven't been signed, but it's all a part of a larger effort to learn where we are with that, and then where can the county actually support, and then bringing our healthcare workers into the room who are like, we don't know what's going on, we don't have a plan. I'm like, okay, that's good to know. That's good information. Even if you don't feel like that's actually helpful, it totally is, because now you can start taking the steps to help you have continuity of operations along with the city and see where we can plug these holes, or at least plan on plugging them. We'll see what happens during an actual emergency.
That's so awesome. Thank you for accepting the invitation to share more. And yeah, I think that you're touching on a piece of the work that we talk about of like, we don't have to be perfect to do this work and to do it well. And that we can make a lot of movement alone, and we can make a lot more movement when we work together. So those are also the vibes in this space that we continue to share with each other. Um, this was very exciting. I'm going to pause myself again. Dolly, do you have any other thoughts about this or see us moving the conversation
Yeah.
in another
So
direction?
here, everyone, here's what I want to say to you. As we're reflecting and we're thinking about what we can do next year, I want to give you all a bit of a heads up. We're working on quite a bit on our end. We're always looking for money. We're having all of our budget meetings and preparing to propose that to the legislature. We are committed, and OHA is committed to maintaining public health modernization. Um, and we're planning on rolling out the public health equity grant for a third time. And I want to plant a seed for you all that we are going to be asking you about your friends and your partnerships. And are you connecting with local public health? How are you connecting with them? Everybody, it's your chip and your cha and your shaw times. State health improvement plan, county health improvement plan, all of those times. What is everyone doing? How could we work together? Hmm. Your organization is similar to mine, but different. How could we work together? Hmm. Who are you reaching out to? Don't wait until the last minute to introduce yourselves to each other. How can you be working on that now? So, as we get ready to build out your training content for this next year, your topic of interest, it's going to be one to prepare you for what we know is going to come as far as funding opportunities. And for our LPHA partners, we have been hearing loud and clear the types of resources and supports you need. And so we will have a workforce piece. I'm working on it, and I want to just tease you that we will be doing some rural health equity data trainings starting in 2025. We will be working with the Northwest Center for Public Health Practice. We will do in-person trainings in Salem and in Bend, and we will also have a virtual option. So stay tuned as we share more training and learning opportunities with all of you. It is coming. Get excited and start thinking
Share
about
more.
who you might be friends with. With that being said, what do you want? What are you interested in for 2025? And we'll do our best to find you subjects, speakers that can speak on those topics that you are interested in. Heather, is that the question? What do you want to know next year?
Yes, that is one of the questions. And just a reminder for folks that we know you have already let us know that you want to hear more about the 1115 Medicaid waiver benefits as they continue to roll out. There's four. We've heard about two so far. So we've got that on the docket. I won't say it's scheduled yet. We're picking out the months and things like that. You also, I said that you would like to hear more about the state health assessment, the results, and the state health improvement plan priorities as those are developed. So if you want to say, I upvote those, that's cool too. But we already have that information. So what do y'all want to talk about, learn about together? Um, hope that you can put another tool in your toolbox and apply to the work that you're doing in your communities.
There's a request to hear about how others implement their chips. FYI, Lincoln, Benton, and Lynn counties are working together on a regional chip and implementation. So if anyone's interested, shout out to Amy and Jamie. Now you're part of our family. Welcome. She's left contact info as well.
Ooh, okay. I
Legislative
see.
process. Ooh, request for a session about the upcoming legislative process. We can do that. Mental
Yeah.
health. Ooh, equity and diversity in rural Oregon communities. Okay. IHN leading the way in collaborative chip work. Hooray for Lynn Benton Lincoln. Woo woo, lots of shout outs. Can I get connected to someone here about our regional chip implementation? Benton County. So someone hit up Sarah. You're gonna be best friends now. Okay. I'm interested in learning about how other communities are implementing climate adaptation work. Ooh. What are they doing? Which issues are they addressing? Anything besides heat and smoke? Great questions. Information about how Oregon is maybe hopefully planning to deal with potential future Medicaid restrictions. Yes, please. I also want to know the answers to that.
I also will share this question has come up internally for public health division staff as well. And I just will repeat something that our new public health director, Naomi, um, has shared multiple times, which is we don't know what is going to happen. We can't predict the future, and we don't know what potential is maybe or hopefully things may come our way. However, what will stay the same is that we are holding steadfast to our commitment and the work that we have, which is to make sure that the people in Oregon are healthy and well and that they are able to access care. So I will take this as an opportunity to repeat the information and the statement that has been shared by our new public health director. We don't necessarily have all the answers and we can't predict what's going to happen, but what we can commit to is that we are here and we are going to maintain the work that we do in serving the people who live in our state. So I will just seemed like a good opportunity to reshare what Naomi has shared recently as well. Oh, and I see a hand.
Hi, Misha.
And thank you so much for that, Heather. And that's, oh, I may have jumped ahead, but th those are basically the words I've also been sharing with our parents and participants who have been coming to me and to some of our meetings, just really, really freaked out. I just won't mince words about and about what may they may be facing. So it's good to hear you say it too. And I'm also hoping, you know, I don't know this time or place, but the Oregon's budget does look good, right? I mean, we've had giant kickers, and maybe we can start to plan more about, filling, creating a larger budget. And maybe now's the time when we may not be getting, or maybe not able to anticipate getting as much from the federal government. So anyway, I'm just really hoping those messages are trickling up, down, across to the powers that be. I definitely have a lot of folks who are very concerned about things like that. So, but thank you very much. And I know we don't know. I know we simply can't know as well. And we all are here doing all we can and committed to what we're doing. So thank you.
This is what I have to say. as long as the state of Oregon will have me until I win the Powerball, we're gonna keep showing up and we're gonna keep trying to figure it out every day. So I think we can count on that until at least, I don't know, 2070 or something when I can retire. So maybe it's like 60, 2060. I don't know. Okay. I see so much happening in the chat. Y'all, if you're not sharing info with each other, if you're not making friends with LPHAs in this chat right now, I don't know what you're doing. If you need to reach out, if you need help connecting to CBOs in your area, I see Karima asking to be connected with BIPOC CBOs in Southern Oregon. Lots of happenings in the Valley, uh, Lynn Benton, Lincoln. So y'all, this is exactly why we're bringing you together because when we're alone, that's a lot of work. But when we come together and we pull our knowledge and our resources, this is what happens. It's magical. We can't make this up. We can't make it up. Truly, this is one of my favorite spaces. Uh, we have work to do for 2025, Heather and Sarah, so we'll get on it.
Yeah, and for folks, yeah, I'm also just right. I have the chat off on a screen, and y'all are just like showing up in the chat today. So I also just want to follow with that gratitude, Dolly, that you shared. Um, I want to just thank you. I know that I will not speak for Dolly or Sarah, but can guess that we like this space would not be impactful and would not have significance if you all didn't show up. Because I know that Sarah and Dolly and I can have some really great conversations, but if it's just the three of us talking at each other about what's happening inside of OHA, we would miss a lot of opportunities. And so I would just like to, as we're kind of closing out our hour, take the opportunity to thank all of you for continuing to show up to this space, for recognizing that whether or not this space has an impact is directly related to how you all are choosing to bring yourselves into this community, for your persistence. I saw a lot of resiliency being talked about of what you were proud of in the chat earlier, and staying true to the vision and the values that you have when you are doing your work in community, and that you're choosing to come to this space and you're choosing to share it with other people who share your vision and your values in their communities. So thank you for making this space as successful as it is. It would not be this way if you chose to use your time on the first Thursday of every month doing other things. So again, I will not speak for Sarah or Dolly, but I just wanted to pause, and yeah, want to have some opportunities to express gratitude, because I love a meeting. I love facilitating a meeting, but it doesn't make any sense for me to do it if I'm talking to myself. So I don't know, Sarah or Dolly, if you have anything you want to share with the group as well. No pressure.
See you next year.
Hope you all have a wonderful beginning to winter season. Good end to this year, beginning of next year.
And I will close with, per usual, you will get a follow-up email from me with this recording so that you can sit in all the feels as many times as you need. And please be on the lookout for the next Zoom invite series that's coming for the 2025 season year. And heads up for folks that are excited about just getting us kicked off in January. That'll be the 1 month that we're actually going to hold it on the second Thursday, because the first Thursday is January 2nd. And I have a feeling some folks are going to want to use their PTO. Also, use your PTO. So see you in 2025. Thank you for coming. You know how to get a hold of us. Appreciate you. And thank you for spending this year with us, folks.